Welcome to Why I Vaccinate, presented by the Franny Strong Foundation and the Michigan Department of Health and Human Services. I'm Ann Thomas. I am here with my co host, Veronica McNally. And Veronica, on this edition of the show, we're talking about keeping families healthy and safe from vaccine preventable diseases. Our first guest is Dr. Sheala Jafry. She is a family medicine physician with Beaumont Health Family Medicine Residency Clinic in Sterling Heights. Welcome to the show, doctor.
Thank you for having me today.
And I'm going to let Veronica kind of kick off the questioning here. Go ahead, Veronica, take it away.
Great. Hi, Dr. Jeffrey. I am really interested in understanding where things are right now with COVID. I've heard that cases are on the rise, and I'm wondering what you're seeing on your day to day in practice.
So, recent articles and recent numbers, it's slowly ticking upward a little bit from the current Free Press article from the end of April till now. There's been a 20% increase in the numbers. But due to vaccines and people having prior COVID, there's less ICU admissions, less patients on the ventilator. And thank goodness for home testing. People are testing at home and then staying home and masking. So the vaccines are working, and people who need to get a booster should go get their booster sooner than later.
When patients come in to see you right now and you're testing them for COVID, what are you seeing in terms of a positivity rate?
So patients usually, if they are having symptoms of COVID, we do a phone or video visit still, depending on where you are clinically in an office setting. But most people that are testing have either been exposed to someone, need to be tested for work or travel. And some people are just having mild symptoms like a sore throat, cold symptoms, mild fever. And thankfully there's testing and they can do the rapid test or go to an urgent care and get a PCR test.
Is there anything right now that kids are able to do for maybe to help them get over it quicker? Are there anything you're telling parents to do?
I think the biggest thing is if you're in surroundings where you don't know people, wear the mask, especially indoors in crowded situations. And with any viral illness, staying hydrated, getting enough rest, getting vitamin C, eating healthy. But the biggest keys are hydrating, resting, and taking care of your body, good hand washing, and masking.
So for the parents who have children under 5, what are they saying to you about COVID and COVID vaccines?
A lot of people are waiting for the approval because they want to get their children vaccinated. We're keeping an eye on the studies and we're educating. The biggest thing is to ourselves get vaccinated so we can protect our elders and our children. If you're in big crowded areas, keep the mask on to protect yourself and others. Evidence shows it's protective for us for not getting the disease, and it's protecting other people if you're an asymptomatic carrier, not giving someone else the disease. And, go outside, enjoy the fresh air. Outside is good. And know the people who your cohort is or who your surroundings are.
Yeah, that's great. I know Anne is a grandmother, and I know she has some questions for you too.
Sure.
Doctor, how are parents doing just getting regular childhood vaccinations for their children? Are they starting to get caught up, or are you still seeing a lag with regard to that?
There is a lag still from 2020, and I look at patients' charts, and a lot of people haven't been in for a year or over a year. There's been multiple reasons. When COVID started, we started doing video visits and phone visits, and then people slowly started trickling in. But a lot of the older people, geriatric people, are afraid to still come into the clinic. But we're telling them, mask up. If you're vaccinated, come in. And most clinics are like a green zone. If you have a cough or a fever, we switch you to a phone or telephone visit. All the patients are screened before they come into the facility. And that's why we have the urgent cares for people to get tested. And the urgent cares have you wait in the car, and they'll tell you when it's your turn to come into the room, and they'll test you. So it is sad. A lot of everyone's behind. People are behind with their mammograms. People are behind with their vaccines. Call your doctor, make an appointment, wear a mask, go get checked out. People are behind with their flu shots, their pneumovax shots. And the wonderful thing is there's COVID vaccines at pharmacies, at grocery stores. The access is so much more available than it was 2 years ago. So it's out there. Just call, make an appointment, go to the local pharmacy, call your doctors and make your appointments and get checked out. We all need annual physicals to help prevent disease and do screening. So please call your family medicine doctor, your IM doctor, your pediatrician, and get in and prevent these diseases that are totally preventable.
But why do you think parents are behind with regard to getting the vaccines for their children? Do you think it's because of COVID, they're afraid to come in, or do you think there's a vaccine hesitancy problem out there? What are you seeing?
I think it's a combination. I think a lot of people are working from home and they're multitasking, so they can't get to the doctor's office. We're all working like 9 to 5 from home. The kids are back in school. There is some vaccine hesitancy, but I think the biggest advocate is yourself. And I tell everyone I'm vaccinated, my children are vaccinated, my mom is, my in-laws are, everyone in our family is vaccinated. And mild side effects, just like the sore arm. But biggest thing is education. And number two is asking why they don't get vaccinated. What is your why? What are you scared of? What did you hear or read? And the biggest thing in 2020 and 2021 is when I would get those phone calls, I would ask them why, reassure them, and then I would go over their history. Okay, you're diabetic, you're elderly, you're on chemo. Why do you not want to get vaccinated? Don't you want to see your grandkids? Don't you want to go back to seeing your family? And thankfully, a lot of people understood because everyone hears that story from a friend. And it's just like, is that a reliable source? Always check the source. Is it an official study or is it hearsay? And I think the hearsay is what scares people. Like heard this on YouTube or a friend told me, who is that friend and is that real? So check your sources, ask your doctor, ask someone you trust who's in the field and has been personally and professionally dealing with this.
Behind the scenes, what are the conversations with regard to a possible new updated COVID vaccine coming soon?
So it's still in trials. There's research going on because there's different variants. I did speak to Dr. Gilpin last week, and they're still in the works for the newer vaccines.
But do you think we'll probably see something maybe in the fall or the winter of next year that'll be updated and then we'll be getting, like, let's say, a yearly COVID vaccine?
Hopefully. Yes, I think that's where we're going towards, just like the annual flu vaccine, because there's a shift, like a mutation, and it changes. So I think we're going to have the same thing with the coronavirus. But I will say people over 60, people that are immunocompromised, people in the healthcare system, please go get your booster if you're due. Mine's coming up in May for my second booster, and I will go get boosted.
And you're going to do it no matter, even though it may not prevent you from getting COVID, it will definitely help keep you out of the hospital.
That's the biggest thing. It decreases the severity, right? Even right now, the ICUs are not filled. People are not going to the hospital, depending on your comorbidities, like, if you have diabetes, hypertension, asthma, those people are getting better at home with care, with family care and people taking care of them. So I think if you've had COVID, you should still get vaccinated, and then you're super immune. You have natural immunity and the vaccine's immunity.
Dr. Sheala Jafry, family medicine physician with Beaumont Health Family Medicine Residency Clinic in Sterling Heights. Thank you for the great advice and for your time today.
Thank you.
You are listening to Why I Vaccinate. We'll be back right after this.